Hello, everybody, and thank you for joining today's virtual office hour session. For more information about the 2021 MIPS Qcdr and Qualified Registry self-nomination applications. Today's session is intended to give attendees the opportunity to ask questions about the self-nomination process for the 2021 performance period of the merit-based incentive payment system. So now I'll turn it over to Hector Cariello, Qcdr and Registry Task Lead, to begin. Hector?
Thank you. Before we begin with the question and answer session, we just wanted to go over some information really quick. Next slide, please. Next slide. All right. So we just wanted to go over the resources and who to contact or who to call if you need assistance. As most of you are familiar with, some key websites for resources are the Quality Payment Program website, the Quality Payment Program Participation Status Tool Lookup Tool, the MIPS Explore Measures Tool, the QPP Resource Library, the QPP Webinar Library, the QPP Help and Support page, and then we also highly encourage everyone to subscribe to the QPP listserv. That's available on the Quality Payment Program website. That way you can receive updates and announcements regarding the QPP program. Next slide. Also, in terms of who to call, you may contact the Quality Payment Program for support. You can do so at the email and phone numbers listed on the screen. Emails must be sent directly to the Quality Payment Program, not forwarded or copied, and must utilize the Quality Payment Program email address in the to line. Inquiries forwarded to the Quality Payment Program are sent via email with the Quality Payment Program in the copy line or CC line will not trigger the creation of a case number for your inquiry. To ensure that inquiries are routed to the appropriate subject matter experts, we ask that all inquiries must be submitted through the Quality Payment Program and not the Qcdr or Qualified Registry Vendor Support mailbox. As a reminder as well, for today's call, please keep the questions for today's session around the self-nomination form process. Next slide. And I'll pass it over to you.
Okay, great. So we'll just begin the office hours session of today. To ask a question, you can do so by submitting your questions through the chat box on your screen, and we'll read it out loud to be answered. Or you can also raise your hand icon in the go-to menu and just keep that icon toggled, and we can go ahead and unmute your line to ask any question over the phone. Okay, so feel free to submit any of the questions you may have or toggle your hand icon, and we'll wait a few minutes for questions to roll in. Okay, looks like we have a question on the phone line from Subir Saha. So Subir, we're going to go ahead and unmute your line. Okay, Subir, if you'd like to ask your question, please unmute your line and you may go ahead.
I'm sorry, I was just playing around with the hand icon. I don't have a question as of yet. Sorry about that.
Okay, no worries. We'll stand by in case you do have a question. Okay, we just had a question come in through the chat box. They asked, we are an approved qualified registry for 2020. We do not want to reapply for self-nomination for 2021. How do we make sure that we do not receive any penalties?
Sure, so this is Hector. The self-nomination process is an annual process. So if you do not want to participate for 2021 and you are an approved qualified registry or QCdr, you should have a simplified self-nomination form already created for 2021 in the Quality Payment Program self-nomination tool. You can just go and withdraw that self-nomination from the tool, and that'll just let us know that you do not intend to self-nominate for 2021.
Great, thank you. Okay, next, for the DVER section of the nomination, I understand that quality and improvement activities is in scope, but what about promoting interoperability?
Can you repeat the question? I'm sorry.
Of course. For the DVER section of the self-nomination application, I understand that quality and improvement activities is in scope, but what about promoting interoperability?
Oh, thank you. Yes, so for the data validation plan section of the self-nomination form, qualified registries and vendors or third-party intermediaries are required to support all three. So that's quality, improvement activities, and promoting interoperability. The only exception is promoting interoperability if you qualify for the exception based on having all of your clinicians or groups fall under one of the exempted clinicians or settings. So for the data validation plan specifically, you do have to include all three categories in terms of your process for verifying that the 2021 measures and activities are in your system for 2021, and then also they should be included as part of your randomized audit and your detailed audit for your data validation
Yeah, and this is Sophia. Sorry, this is Sophia Sigmar. Just to add to what Hector was saying, elaborating a little bit further on the PI exemption, all the clinicians who are supporting must be of that given exemption type, clinician type. So if you're supporting a multidisciplinary group of clinicians, you will still, and not all of them are exempt from PI, then you will still be expected to support the promoting interoperability performance category.
Great, thanks for that. Okay, as a reminder, if you'd like to ask a question over the phone line, please ensure that you've entered your audio PIN. You can find that under the audio drop-down menu on the go-to menu, and that just ensures that you're connected to the audio line. Okay, so next question. We have a few people who are new to their roles. Can you please clarify the point of self-nomination and why they should do it?
Sure. So this is Sophia. I will start, but feel free, Tim's team, to jump in. So the self-nomination application process is there for those organizations who wish to self-nominate to become either a qualified clinical data registry or a qualified registry. Essentially, to act as a third-party intermediary that would support the data submission from clinicians to CMS for purposes of the MIPS program. There are certain criteria you would have to meet to become a Qcdr or a qualified registry, and we do have a self-nomination toolkit that provides on the QPP resource library that provides all those specific requirements you would be expected to meet if you wanted to qualify to become either a qualified registry or a Qcdr. The Qcdr qualified registry program is available for organizations that meet the criteria. Typically, clinician offices, single doctor solo practices do not qualify to become their own third-party intermediary. For those that are clinicians that are looking to utilize a third-party intermediary, we do have, on a yearly basis, we post a qualified posting at the beginning of the year that will list all the approved vendors. So we do refer you all to utilize that self-nomination toolkit on our QPP resource library to ensure that you meet the criteria of a Qcdr or qualified registry.
Great, thank you for that. Okay, we have one question coming in through the phone line. So Jamie Camargo, you may go ahead and ask your question. Your line has been unmuted.
Yes, hello to everyone. We have been doing quality. We've been a registry since inception, but we've been focused solely on quality. Now, this year, it seems that PI and IA were required to support, and we're just wondering, we just don't know where to begin to gather the data. Are you asking us that our customers attest that they are meeting the requirements per measure? or can we just create a website where they can attest to each measure? Is that what you're asking we do in the data validation report for PI and IA?
So for purposes of what is expected of you as a qualified registry for 2021, it's that you support all three performance categories, as you stated, and facilitate the data submission for those three performance categories. So how that's done, the nuances of that, we don't specify our expectations. We leave it to you as the qualified registry or the qualified the Qcdr to determine the method in which you will help support or facilitate those clinicians with data submission for those three performance categories. The point that we are trying to make with this requirement is that should a clinician or a group wish to use your qualified registry or Qcdr to submit data for any of these three performance categories, you should be able to support and facilitate that. And this links into future years where there will be MIPS value pathways available where data submission across all the performance categories is required. And if a third-party intermediary is to support an MVP, they would have to actually support data submission across those performance categories. So I know IA, requires attestation. So the nuances of how you want to operationalize that in terms of supporting clinicians is up to you. But we want that to be clear that the expectation is that you, from a Qcdr or qualified registry standpoint, have that capability to facilitate data submission for the three performance categories. With regards to data validation, we do have our data validation requirements, and there are separate data validation requirements for PI and IA. Those are listed and I believe posted in the QPP resource library. We are suggesting that based off of the sample that you would collect at the time of auditing, you would utilize those that are selected in the sample and audit across the performance categories. And we would suggest that you use the requirements or the structure of validation that's provided by the IA and PI performance category to conduct that validation for those two performance categories, if that makes sense.
Okay, thank you.
Okay, great, thank you. All right, your next question asks, in self-nomination, we are asked to stipulate whether our Qcdr measures include telehealth. So if we need to add the telehealth POS to our denominator, does this qualify as a major change to the measure, and will this affect benchmarking?
So yes, we have asked, and a lot of the measures, if it didn't have that exclusion, may have already included the telehealth, because just general E&M codes can also be billed for telehealth. So I think we're going to look to you as a Qcdr to determine whether or not this would be considered a change, adding the POS. I think it's just a yes or no if you're going to allow telehealth to be included. And then really you're going to have to take a peek at the quality action, whether or not it would affect the benchmarking. We do have a lot of the measures in response to the pandemic that have proposed a substantive change to the MIPS measure, and we are not considering a new benchmark. We did not propose that, but for the 2021 performance period. But definitely take a peek at your measure and what the quality action is, and whether or not it really can even be captured during telehealth, and assess, was it eligible before and now is it not going to be, things like that, and then provide that feedback in your measure template.
Yeah, and I will just add to what Jocelyn's saying, that in the 2021 NPRM, I'm not sure, we did discuss this at yesterday's webinar, that we have proposed the possibility of utilizing performance period benchmarks for quality measures, and that's in light of the pandemic. So at this point, we can't guarantee, the type of benchmark that will be used. What Jocelyn has indicated as our typical process of when we would typically remove a historical benchmark and utilize a performance period benchmark if the change is determined to be substantive. But again, in light of the pandemic, there has been a proposal in the rule. So certainly, if there are comments for that, we are certainly open to hear them through the comment period and suggest you formally submit any comments regarding that proposal. But again, that is still something to be determined.
Okay, thank you. Okay, next, do we need to select 3% of TIN and PI combinations with minimum sample size for each and every category, quality, II, etc., for the audit, or can we split the 3% of TIN and PI combination samples between all three categories?
You only have to do the sampling once. So how we typically try to explain it to our existing Qcdrs and registries is that you would conduct your sampling methodology to kind of gather your sample, and then from that point you would audit for the 3 performance categories across the board. So you wouldn't do any splitting. All of those clinicians and groups that are identified in your sample, they would be eligible to be audited across the board by you for each of the performance categories. It really depends on whether or not they actually submitted data for those performance categories. So they might have just submitted for quality, they might have just submitted for 2 of the 3 performance categories, and that's fine, but you would then, because they were selected in your sample, audit for those specific performance categories that they intend to submit data for.
Great, thank you. Okay, next, if we use measures in our Qcdr that are stewarded and owned by another organization, do we need to propose the same links to cost measures and improvement activities as the measure steward? They've received mixed feedback and are looking to clarify.
I do believe we do provide, that's one that can be varied among Qcdrs. So as you're filling out the measure template, that's not a grayed out field, and so it can be different because there may be a different specialty using a broader measure and how it applies. So we do allow a little bit of variation when it linking that back to an IA or a cost.
Great, thank you. Okay, next is a two-part question. So first, do you have any examples of the amount or type of information that should be listed in the column AU, describe link to cost measure / improvement activity for the Qcdr measures? And are you looking for a sentence with a link to a specific cost measure or improvement activity if applicable? Basically, how much information would you like to see in this column, and what should be provided? I can find that. You read it one more time, or Sophia, do you have an answer? Yeah, I can go ahead and reread that. We're looking at column AU. It's described link to the cost measure or improvement activity for the Qcdr measures. The question is basically asking, do you have an example of the amount or type of information that you'd like to see? Are you looking for a sentence with a link to the measures or activities, or additional rationale? Okay. Sophia, do you want to answer this?
I can start, but certainly feel free to jump in.
Okay.
So in terms of what we're looking for, I think our intent here is for you to identify a linked cost measure or improvement activity. And so where you find relevant, there's something you can kind of foster that relationship between a measure, Qcdr measure and an improvement activity or cost measure. You can certainly identify that specific measure or activity by name. What we're looking for is, from your perspective, a rationale as to how they are related to one another, measure and activity-wise, why you would correlate them into a relationship, just for our understanding, because there can be different perspectives on how measures and activities can link, and really we're looking for you to kind of provide that, explanation to us. Not looking for, a essay or anything like that, or a long detailed, we're just looking for you to just, and you don't have to, provide the details on the improvement activity or cost measure. I think if we're given the title, we can certainly look it up, but explaining how you feel it's linked to your Qcdr measure gives us some perspective and, helps us really see where you're coming from. So it doesn't have to be a long, elaborate, paper or anything like that. Just a short and clear explanation of how they are actually related to one another would be fine.
Okay, great, thank you. And the second part of that question asks, if there's not a clear link to a cost measure, would you put NA or no link identified? Is that okay to list? And can you clarify what the process is if they do list no link for review by CMS?
It's perfectly, if there's no, I think we encourage the linkages between the cost measures, improvement activities, and the QCDR measures. But if one does not exist, that's fine. That's not a criteria to, eliminate a measure or reject a measure. That's definitely not it. We're just trying to get our QCDRs in the habit of thinking of these relationships as we, eventually transition to MVPs, and we're trying to create MVPs with relationships between measures and activities. This is trying to get you to think in that manner. So that's the intent of that requirement. So if there's no link, just simply state that there is no link identified, and that is just something perhaps you can track to in the future to try to think of how the QCDR measure can link to new improvement activities or cost measures that are brought in the future in order for there to be consideration of a future MVP in that area.
Okay, thank you for that. All right, next we have a phone line question from Minori Rios. So Minori, we've unmuted your line, and you may go ahead and ask your question. I believe you need to unmute from your side as well. All right, Minori Rios, if you'd like to unmute your line, you can ask your question.
Okay. Hi, can you guys hear me?
Yeah, we can hear you, thanks.
Great, thank you. So I also have a two-part question. We acquired another company, and that acquired product receives ECQM results from its clients. There's no ECQM calculation within the solution. So I was wondering, one, in our self-nomination, should we include the ECQMs for which data is being received, even though we're not performing the calculation? And two, are we okay to submit that data through our registry API when submission season comes around?
So you're receiving the data, but you're not doing the calculation on the method.
Correct. We only calculate CQMs, but not the ECQMs.
So without the calculation, though, the data could not be processed, right?
So they
send
us a file where it's like the measure results are being fed into the dashboard, and we perform some trending in that solution.
I don't know, Pam, do you guys have any? I'm not so familiar with my.
I don't know if we'll need to, I don't know if this is completely self-non-related. We may have to reach out to the product side, maybe. I'm not sure.
Okay.
Yeah, I think we
post a question to the QPP support. I can certainly do that. I just wanted to, with the deadline coming up, I was trying to figure out how we should, state what we are supporting and whether we're allowed to state that as well.
I think we'll need to clarify with the the ECQM team about whether that's allowable or not. So I don't know. And did she say she already has a ticket out for QPP Service Center?
I do not. I can create one though.
Okay. Yeah, if you could, that would be great because we could then follow up with you.
Sophia, this is Marla. So is the question, they're receiving 2020 data, so they don't necessarily have to self-nominate for 2021 if they don't want to support those ECQMs. Is that what they're saying?
Well, for 2021, you know, we're looking to potentially do some integration with the products in the future, but that doesn't exist yet. So, I mean, if I'm required to state that we are supporting these ECQMs because we're receiving the results, I just need to make sure that I capture that correctly.
Yeah, I think for this one, we better get offline and get back to the questioner.
Okay, no problem. Thank you.
Okay, great. All right, next, can you please provide an example of a cost measure?
Sure. So two of the broad-based cost measures that are available are the total per capita cost for all attributed beneficiaries measure, and there's also the Medicare spending per beneficiary measure, which is MSP measure. If you go to the QPP resource library and filter it to the cost performance category, you can get I think the entire inventory of cost measures, because they have, separate from those two broad measures, some episodic, they're more specialty specific related cost measures that are available. So I would refer you to the QPP Resource Center for that entire listing.
Great, thank you. We will also share a link to the QPP Resource Library through the chat. All right, next question asks, if nominating as a new Qcdr by utilizing an existing Qcdr's measures, does a written agreement between the two entities suffice as collaboration, or would a whole new legal entity need to be created?
I think we need some clarity on the question, because it could be taken two different ways. It could be taken in an instance where you have an existing Qcdr entity, and that existing entity is going to collaborate with a new entity to become a new Qcdr, which is a collaboration. And separately, if you're a new Qcdr and you're utilizing existing Qcdr measures, that's entirely different. So I'm just trying to go back and read the question. If you're utilizing someone else's measures, QCDR measures generally, you must receive their permission to do so. And that permission must be in place by the time you self-nominated. We do, check that. We validate that you were given permission. I'm not sure if this specific questioner is trying to create a new QCDR that's a partnership between two organizations. If that's the case, then there are specific requirements that those legalities of that partnership must be in place before you self-nominate. Hector, do you know the exact time frame off the top of your head for when that's supposed to be done by? I believe it's September prior to the performance period, but I cannot remember off the top of my head.
It's September 1st, yeah. Can you hear me? It's September 1st. It's,
yeah, thanks, Hector.
Mm-hmm.
Okay, great. Thank you for that. All right, your next question asks, regarding the new measure field this year, asking for measures to be linked to cost measures and CPIAs, most cost measures do not apply to specialties outside of primary care, surgery, and hospital medicine. Ethical improvement activities are also limited in some cases. So will these QCDR quality measures for other specialties suffer without linkages to existing cost measures and activities? And what is your recommendation for QCDRs moving forward regarding creation of these linkages?
So we do indicate in the rule that they're encouraged, the linkages, but they are not required. Measure certainly won't be rejected because there is no linkage. Just in that field, if you note that there is no relevant cost measure or the improvement activity related to your QCDR measure, just please make that clear in that specific field. In terms of long-term thinking, the reason why we would like our QCDRs to start thinking this way is as we move to MVPs are going to be created with the thought process that the measures and activities should link to one another or have relationships. So the idea behind this policy was to have our QCDR start thinking this way, in the sense where you all have the ability to develop and implement QCR measures in a much quicker manner than our typical rulemaking process requires. So we would like you in the long term to consider, the existing inventory and future inventory of cost measures and improvement activities. If you are one of those organizations that are finding yourself to be interested in MVP and MVP creation, it certainly helps set you up for that direction if you start thinking like that for the future. So just encourage you all, if it's not possible now, to start thinking about it in the long term.
Great, thank you. Okay, your next question is about the process that should be followed in the detailed audit if an issue is identified in the randomized audit. They indicated on their self-nomination form that they would further investigate and audit at least 10% of clinicians and groups not originally identified in the group affected by the error. Is that sufficient, or would further detail be necessary?
Yeah, I think what we recommend, and whether you choose to audit a sampling group that's bigger than that is completely fine. We suggest the auditing for a sampling methodology that's used for your randomized audit. We suggest utilizing that same threshold, those same thresholds for your detailed audit when errors are found in the randomized audit. However, if you choose to, if you have the capability and want to audit further than what's required, that is totally up to you. In terms of would that 10% be sufficient? I believe it would be. It seems like that exceeds our current thresholds that we have for our sampling methodology. However, if, upon reviewing your data validation plan, if the team has questions, they will certainly reach out to you through your self-nomination application to clarify any component of the data validation plan before they approve it.
Great, thank you. Okay, as a reminder, if you'd like to ask a question over the phone line, please just toggle the hand icon on your go-to menu, and we will unmute your line. Otherwise, you can always submit questions through the chat box to be read out loud. Okay, so your next question is from health data IT vendors. Understanding that the self-nomination form is for the 2021 performance period, they have a few providers who are already registered for MIPS. Can they sign them up in 2020 and do their MIPS reporting for 2021?
So they are a health IT vendor. This is self-nomination for 2021. If they're a health IT vendor, then they are not, I'm assuming they're not a qualified registry at a minimum. So the health IT vendor requirements are separate from that of QCDRs and qualified registries. Typically for QCDRs, I can only answer this question from the QCDR and qualified registry standpoint. We allow the QCDRs and qualified registries to set up end dates in terms of when they will allow the last client to sign up to them, to their registry or QCDR for services to help. So that is to the discretion of the vendor. We ask that you include that information. It's a part of your qualified posting that we publish. For health IT vendors, I'm not so sure if that is a question for your specific organization related to you being a health IT vendor for 2020. You might want to submit your question to the QPP Service Center to get the appropriate subject matter expert to address that.
Okay, thank you, Kithia. Okay, next question asks, what is the role and responsibilities of the individual that they need to list as the clinical contact for the registry?
Yeah, so I guess when we request the contact information, there may be clarifications on the measure that we might reach out for. In addition, they might attend some of the the support calls and things of that nature and be on that emailing list?
Yeah, and I think just to add to what Jocelyn said, we typically ask for at a minimum 3 unique points of contact. We have come to find when entities have listed the same person for every point of contact, and sometimes they're not reachable, it puts us in you know, scenarios where we can't reach out to them and they're not responding to us and they're missing deadlines or missing support calls and things like that. So our specific ask is that you provide 3 unique points of contact so we can ensure that there is some line of communication between us and your organization or your qualified registry. The clinical contact is primarily, as Jocelyn mentioned, for us to follow up if we have any questions regarding the types of quality measures that you're supporting, or specifically more so comes up when the Qcdr measures are involved. If you're a Qcdr and you have developed some qualified clinical data registry measures, and there are specific issues or questions we might have with the measures themselves, that would be the point of contact we would want to discuss with primarily.
Okay, great, thank you. All right, your next question asks, if we were a registry for 2020 and we only see a new self-nomination form instead of a simplified form on the QPP website, who should we contact to ensure that we are filling out the correct self-nomination form?
So typically the simplified self-nomination form, or what is referred to as like a pre-populated self-nomination form, is available for existing vendors who are in good standing. So if you are in good standing and you don't see that yours is available, please reach out through the service center, and the PIMS team will work with product to make sure that is fixed. However, if you've been placed on remedial action, you will notice that no pre-populated form is available to you, and that is because that is limited to those that are in good standing.
Yeah, this is Hector. And just to add to Sophia's response, if you are a new vendor or an existing vendor that's not in good standing, you will not see a new self-nomination form in the self-nomination tool. You would actually have to go and click on new and create a new self-nomination. So like Sophia said, feel free to reach out to submit a ticket and we can help you with that.
Okay, thank you. Okay, again, if you'd like to ask any questions for the team on the phone, please raise your hand and we can unmute your line. Otherwise, please feel free to submit any questions via the chat box to be read out loud. Next question asks, for the detailed audit section of the self-nomination, is there a minimum sample size required when we find an error? For example, there's a minimum sample size specified for the randomized audit, which is 3% of TINs and 25% of the patients of those TINs. Yes, please clarify for the detailed audit section.
Yes, our guidance is for you to use that exact sampling methodology to then derive another unique sample separate from the one used for the randomized audit to then conduct your detailed audit. So same thresholds, but the sample should be unique to what was used for the randomized audit.
Great, thank you. Okay, we have a question on the phone line from Rebecca Swain-Eng. So Rebecca, we are unmuting your line. And Rebecca, if you unmute your line, you may go ahead and ask your question. All right, Rebecca, you should be able to go ahead and ask your question. All right, Rebecca, are you there? Can you hear us? Okay, we'll give it a few more minutes for Rebecca to connect to audio. In the meantime, you have a question asking, can you please review the recent changes with COVID-19 and let us know if there are any columns of the self-nomination form that could be left blank?
Sure. So the impacts of the pandemic and which has led to us in the previous months to publish a interim final rule with comments period relates to specifically the Qcdrs and the Qcdr measures. Two policies that we previously finalized in the 2020 rule that we have delayed to begin only with the 2022 performance period are related to Qcdr measure testing and Qcdr measure data collection. So these two requirements are ones that are listed in the Qcdr measure template for 2021, but it should be listed as an optional field for this year. So if you have any information for those two fields, certainly feel free to provide it. We are happy to have the information. It just makes us have more, our decisions are more informed. However, it's not required, so if it's not provided, it's not held against you. Those are two areas that we will be tracking to for 2022 to be completed appropriately so that we have that information and we will utilize that information for decision making. With regards to the actual self-nomination form itself, I don't believe any other fields are impacted. Everything else is, I believe, status quo.
Okay, great, thank you. Okay, your next question asks, is there a preferred browser for the self-nomination tool? They often have difficulties when logging in with Safari.
Yes, so the preferred browsers would be Internet Explorer, Microsoft Edge, or Chrome. Those are the ones that we use to access it on our end, and are the ones that were we were told by the development team that are the preferred ones as well.
Okay, thank you for that. Okay, your next question asks, can CMS please provide any guidance for doing the improvement activities and promoting interoperability audit in terms of process, i.e. how to audit, or the documentation required for validation?
We can provide links to those resources. So what I had mentioned was that we generally are telling all our Qcdrs and registries to utilize the sampling methodology that we have in place across the board for your data validation processes. And for that sample that is selected for your randomized audit, you would audit across the board for the 3 performance categories. We have indicated that for IA and PI, those 2 performance categories have their own data validation criteria that they have in place. And I believe it's posted on the QPP resource library. If we could provide those links, that would be helpful. We can share those links to everyone. Those resources might be in the process of being updated for, we have the 2020 resources available, but the 2021 ones are not available at this point. But that will give you a frame of mind of the type of validation criteria that each of those performance categories use and the type of documentation that is required. In some instances, I will note that I believe for improvement activities, there is not granular detail as to what exact documentation would qualify to meet validation. And from what I understand, it was done for that reason to provide stakeholders with a bit more flexibility to find documentation that would satisfy the requirement of validation for a given improvement activity. So you might find as you review those documents that the level of detail provided isn't too granular, but that was done with the intent of providing flexibility.
Okay, great, thank you. And again, we are sharing the link to the resource library in the chat. Okay, following up on a phone question that was submitted to chat, measures utilized in their Qcdr are stewarded and owned by other organizations. However, they received feedback in their recommendation report that there were issues with lack of an evidence gap and harmonization issues for some of these measures. That was discussed with the measure stewards, and they've noted that they are working on addressing those gaps. So what information, if any, should be included in their Qcdr self-nomination form about this, other than a brief explanation in the Qcdr notes column?
I think that would be perfect. For the performance gap, I think it's really important if you do have data on that particular measure, maybe you have a little bit more increased adoption than the measure owner. I'm not sure if that's the situation, but any performance data that you can provide would be helpful in that scenario.
Yeah, and just to add to what Jocelyn's saying, the responsibility of responding to the actual feedback will fall to the measure owner, and not those that are borrowing the measure from the QCDR measure owner. However, if those of you that are borrowing the measure do have any performance data on that given measure from your given QCDR, certainly helpful for you to provide that, so that gives us a perspective of performance from your specific point of view. But again, those larger asks, if it's related to harmonization or proposed revisions or things like that, or concerns that we flag, typically that is those are items we flagged for the QCDR measure to address, hopefully for the upcoming year.
Okay, thank you. Okay, again, to ask any questions, please feel free to submit them through your chat box to be read out loud, or you can always toggle your hand icon to read a question over the phone line. We'll stand by for a few minutes to allow more questions to come in. Okay, it looks like we have one more question on the phone line that just came in. So Sohaila, we are going to unmute your line, and you may go ahead and ask your question. Sohaila Damshakon, you may go ahead and ask your question. Okay, we'll give it a few more minutes to connect the audio. Okay, we'll try one more time. Sohaila Damshakon, you may go ahead and ask your question. Okay, no worries. Moving back to questions on the submitted through chat. When will CMS approve the submitted QCDR measures?
Can you repeat that one more time? Just got the end of it.
Yeah, of course. It just asks, when will CMS approve the submitted QCDR measures?
Oh, okay. So I believe the timeline, and Marla, correct me if I'm wrong, we will start reviewing those shortly after they're submitted for the close of self-nomination, and then feedback is we can write it by the end of September, early November, October. So it's about a month after our self-nomination ends.
Okay, great, thank you. Okay, next, as we plan for future measure testing requirements with the two-phase measure testing plan, what responsibility do they have if they use measures from another measure steward to do their own separate phase validity testing in phase 1 and or full measure testing in phase 2?
The responsibility to conduct the measure testing falls to the measure owner. So if you are a QCDR measure owner, then, if the proposed policies are finalized, then that phased approach would be one that would be put we would put into place where face validity testing would be required by 2023, and then full measure testing for that same measure would be required for 2024. So QCDRs that are not creating their own measures or licensing measures from other QCDRs, there is no requirement that you do any of this testing. Essentially, in order for you to have the measure available to you as a borrower, it would first need to be approved by us. And in order for that measure to be approved by us in the future, it would have to meet those testing requirements. And so those testing requirements would fall to the measure owner to meet.
Okay, great, thank you. Right, again, we do have a few more minutes for any questions that you'd like to ask. Please submit through the chat box or ask over the phone line. We'll stand by for a few more questions to come in. Okay, one more question. We're going to try Sohaila's line again. So Sohaila, we've unmuted your line, and you can go ahead. You may need to unmute on your end as well. Okay, no worries. It looks like that's all the questions that we have for today. So Sophia, we will turn the presentation back to you to conclude.
Okay, great. So thank you all for joining today. Hopefully this has been helpful to clarify some of the questions. Strongly encourage those of you that are new to utilize our self-nomination toolkit that's posted on the QPP resource library to help you navigate through the self-nomination process. As you fill out the application, if you have questions, feel free to submit tickets to the QPP Service Center, and they will be triaged to the team for help. For those of you that are existing QCDRs, hopefully this has been helpful to outline any differences, but if you have any questions, again, we will talk to you all next month, so feel free to, next week, so feel free to bring any questions at that point to that meeting. Thank you all, and have a good rest of your week.